Welcome and namaste. So, myself Dr. Kirtan Doshi from the Homeopathic Clinic, Ahmedabad. Today's topic will be for homeopathic doctor and it will be helpful for them. And I will share the significance of past history in homeopathic prescribing by Foubister. This book written by D.M. Foubister. The Foubister has written the another book which is also the very amazing and must read book is the drug picture of carcinosin. I will narrate some important point from this book only because if I will tell each and everything, the video will be very long. So in short video, I will tell some important point or what I have learned after reading from this book. So we all are using the constitutional medicines, and we all know as a homeopath that constitutional medicines are the characteristic or the individual symptoms or the totality of symptoms of the patient from the mind and the body. So more it is on psychosomatic dimension medicines, and this will help in most of the cases. But sometimes on the starting of the case, some there are lack of symptoms or there are lack of individual symptoms in some cases. After giving the best selected remedy or after selecting the best selected remedy, these medicines don't work or work partially. So at that time, the past history or the family history should be viewed, and so this is very important thing to note down that our homeopathic materia medica is also incomplete because so many substances are still left, and that substance are not proven till now. And so sometimes we cannot choose the accurate medicines also for some patient when their constitutional medicine are some unproven drug, right? So many patients are like that there are not well since after some acute infections or some chronic infections or after some injury or after some emotional upset. So at that time this past history is very important. Some patient will tell that after they are not better after some acute infection, or patient recover very slowly after some acute infection. So the group of the drug for this condition are sulfur, sorinum, or carbobase, we all know. But this medicine should be selected on the totality of individual symptoms only. So Dr. Kant and many other author and the doctor are against the use of nosode or haphazard use of these medicines because at that time so many doctors are doing like that. So when it is clear cut indication, only you should start the nosode or anything like that. So in the same way, we know that some rheumatic fever, if starting after some throat infection, so we all know for the streptococcinum is the culprit for the tonsillitis or the throat infection. After that, the immunity got misrouted, and after that, in many cases, the rheumatism or fever or the rheumatism started. So at that time, the streptococcinum should be think of when there is no any clear-cut indication of other medicine. And Swan was the first to use the morbillinum, and he saw the astonished result with the morbillinum. And also, Foubister has said one case of the vertigo of the student when there was no any clear-cut indication of what to give in these cases, and what there is only also the reason was obscure. And this also he this patient had done so many checkup with the ENT, and what I was not getting better, but it has found that after the measles, uh, this vertigo episode has started. So morbillinum 200 had been given, and vertigo was completely got better. In the same way, this ML Tyler, so the Foubister was the student of Tyler. So Tyler had a one case of the rheumatism, and there is no such clear-cut indication what to give. So this rheumatism started after the scarlet fever. This was only the present in the case. So directly, Tyler had given the scarlatina 30, and patient was on the road of recovery. So sometimes these infections or the acute infections are the act as a block to cure, or sometimes you need to clear that layer. What I have learned from this book. In the same way, another case of 8-year-old child has a recurrent furuncle on the back perineum, and it was very sluggish to responding to any treatment. So we all know Staphylococcinum bacteria is a culprit. So Staphylococcinum 30 clear up the case. In a same way, a lady had a severe eczema all over the body, and because of that, also the some secondary infections, and lady was hospitalized for so many years, and she was very sluggish to homeopathic treatment also. And only the symptoms of the eczema and all other complaint are like that. All symptoms aggravated at the night only. So we all know syphilinum or the lucinum are the medicines. So in this book, lucinum or the syphilinum all are the synonyms. So syphilinum has been given, and after the syphilinum case was on the road of recovery, and after the syphilinum, this lady has developed on the crops of the boil. So staphylococcinum given, and all our other complaint also improve with these medicines. In the same way, when any glandular fever are very slow to heal or slow to recover, carcinosin can be think of. Also, when there is a history of septicemia or some severe effect after the dental extraction or some ill health followed after the abortion in the absence of any such pathology, the pyrogenum can be think of. Also, if after effect of the whooping cough, drosera can be think of. So we should view the past history when our so-called constitutional approach not working or there are no sub indications, but haphazard use should not be used. In the same way, we all are using the chronic infection nosode like medorinum, tuberculinum, carcinosin, and these all are well proven also. So sometimes the injury may be hindered to cure. So a lady had a ulcerative colitis, and sepia was the constitutional drug, and it was helping to such an extent, but no any favorable result with the sepia to such an extent. So a past in the family history, this lady has so many in the family of this lady has a cancer. So carcinosin was given, but with carcinosin also not such favorable result. And later it has been found that this lady a few year back had fallen on the bed, and he had severely injured her spine. And after the injury, this ulcerative colitis and everything has been started slowly. So the hypericum has been chosen. So there are so many drugs for the injury like hypericum, arnica, natrum sulf, helleborus. But we should also choose that medicines on the base of individualization. And after the hypericum, ulcerative colitis cure completely. In the same way, there are so many psychic cause that after some cause or after some emotional upset, some disease has been started that we all know. Mortification is for staphysagrия. Sometimes fear, fright, terror are for opium. So another case that a 16-year-old child was very slow in recovery of the influenza. So many medicine has been given, but after viewing the case again, it has been found that over the 12 years, this girl has a usual pattern that sluggishness in recovery from all the acute illness, and it was no any such reason has been found. Only in the past history during the pregnancy it has been found when this baby in the womb of the mother was been frightened by the doctor that your baby will not be saved and you will lose your baby, and suddenly that mother has a panic or the fear attack, and this mother said that I had shock all gone through my body, and on the basis of fear fright prolonged, the opium in a CM potency helped this girl in slow recovery and also in the concentration also. So we all know right now that during the we all know that mother stat during the pregnancy is very important, and mother is the action and child are the reaction. So sometimes the drug, if you are using some any drug for a longer time, this drug act as a block. So we and also some addiction, like we all know alcohol or coffee, evil effect, the nux vomica. If there are abuse of iron, so pulsatile is the medicines. If abuse of quinine, the natramur is the medicines. In the same way, if there are some substance in a crude form has done the poisoning, the same substance or the same poisoning in a dynamic form sometimes work amazingly. So a 4-year-old child has suddenly unconscious, become unconscious, and unable to control urine day or night. And it has been found that 18-month old when this boy right now was 4 year, and when he was 18-month old, he drank the turpentine, and from then these symptoms are coming, and each and everything has been started after this turpentine poisoning. The Terminthina 1M cured this child completely. In the same way, a woman had a psoriasis and arsenic was indicated, but arsenic was not doing great work. So it has been found the psoriasis started after the tonsillitis treatment with the sulfapyride. The sulfapyride in a 30 potency cured the psoriasis. Also, one 14-year-old child was not use the brain, otherwise very intelligent, and also the dullness, sluggishness, and it has been found that during the pregnancy, on account of the osteomyelitis, the pethidine is an opioid drug for the at the few year back it was a opioid painkiller or analgesic. So pethidine on account of osteomyelitis was taken by mother since very long. So pethidine 30 was given to this child, and concentration and ability to study also increased. In the same way, anesthesia history is also important. Like one girl, 10-year-old girl, had a asthma, and constitutional medicine was helping to such an extent. But again, the episode was relapse, and it has been found that this girl had some liver symptoms, and also she was the only child in the family who born under the anesthesia. So chloroform cured her asthma completely. And in the same way, another case of the chloroform, when 20-year-old woman had a colicky pain in a thrice or fourth time in a week, and only the symptom was suggesting of colocin. So colocin had been given, but right now this lady was 20 years, and when she was 8-year-old, his colicky pain has been started, and there was no any such history or specific symptom, but it has been found that so many family history had a cancer. So carcinosin has been given some result or result with carcinosin, but not to such extent. Later it's been found this lady also born under the anesthesia. The chloroform has been given during the delivery of this girl. So chloroform 30 and later 200 had been given, and it completely this chloroform made free from the any colic after this. So sometimes this drug history is also important when there is a hindrance of the cure. In the same way, we all know the family history. If there is a recurrent tuberculosis history, tuberculum, if there is a recurrent so many cancer in the family, the carcinosin, also this carcinosin had a family history of TB, diabetes, leukemia. So we should investigate and look into this. So sometimes these all the things work as a block, or when we give these medicines, there is a smoothen the road of recovery. So I think that's all enough for today. And I have said what I have read from the book. I have said some of the cases. Each and everything is not possible in a short video. So kindly like, share, and subscribe our channel for more such information in the future also. Bye bye. Take care. Thank you so much.